our kind of a high risk units. Again, I spearheaded that one, and they're actually rolling that one out DoD wide as well as we speak. So again, some really cool stuff that I got to do. Really exciting stuff that I was really passionate about in terms of building these services and programs for our, not only our veterans, but our active duty and our family members, our dependents. After about 9 years, actually applied for this position 3 years ago. Apparently I came in second place. And then after I was passed up for this position, I went and I worked for the state within the Family and Community Services Division. And really that division does all the child welfare work in the state of Idaho. So again, any allegations of neglect or abuse of children, our organization would go out and investigate those situations, take kids out of really bad situations, provide them foster care, and try and find them permanent homes going forward. Did a lot of really cool work there, a lot of hard work there within that division for about 2.5 years. And then this position opened up again, and this has always been where my heart has been in terms of being involved in the military or helping veterans. So when this position opened up again, I applied, and I guess second time's the charm. Here I am.
Well, it's great to have you here. I know when I came over to Idaho Division of Veterans Services, I thought I knew what the agency was all about and things, and I realize you've kind of aspired to this position, but you've only been here 4 weeks. What has surprised you about Idaho Division of Veterans Services? Maybe something that we offered that you didn't know about, or something along those lines?
Yeah, I would say that the level of service that we are able to provide our veterans from our Office of Advocacy, and the fact that we have quite a large number of service officers across the state of Idaho really surprised me. And then firsthand, you know, I sat down with Bill, who's our lead manager and chief, and he's like, "Hey, Mark, let's look at your stuff." And he actually helped me with my own VA benefits that I had no idea that I, was entitled to from my veterans, from my service in the Air Force. And I couldn't believe just the level of service that is provided and how quickly those folks can help veterans with their benefits. The ability that how well they're tied into the actual VA systems and are able to expedite those services is phenomenal. Like, blew my mind away. Like, I knew that they were there and I knew they advocated for veterans, but I had no idea they could do the things that they could do and that they were tied so beautifully into the VA system to really fast track those things. So I would say that's the thing that blew me away the most. The other things I was aware of, I would say the second thing that really blew me away was, I think the veteran cemeteries. I think that, it's one thing to help and honor veterans when they're still here on this earth, and it's another thing to gracefully and honorably pass them on. And the veteran cemeteries are just phenomenal, and really provide that, I think, just amazing closure to the lives that our veterans live, and then give them that very honorable send off. So I would say that was probably the second thing that impressed me the most.
That's great.
And then obviously, well, here I am, I'm just like going on, but like the nursing homes, honestly, they're ranked some of the best nursing homes, not only in the state of Idaho, but in the nation. So again, the level of care and attention that's provided to our veterans in our homes is phenomenal as well. And again, I knew we took good care of them, but I didn't know the level of recognition that our homes have gotten for the care that they provide. And so again, that was really something else to find out about. So thanks, Mitzi. I just basically covered everything.
Well, thank you. I would have to agree with all of those points that Mark made. Those were a lot of the surprises that I had when I came over, and I don't think everybody really realizes what the Idaho Division of Veterans Services does. We're going to move over to James Earp. He is our director out at the cemetery for both the overall director for our Idaho Veterans Cemeteries. So I'll let him tell you more about that. And James, a lot of people know you, but if you want to give us a little bit of your background too, for those that haven't met you before.
Sure. Good morning, Mitzi. Good morning, everybody. Mark, it's good to see you this morning. My name's James Earp. I'm the bureau chief here at the Veterans Cemetery in Boise. I'm in my 8th year here at the Veterans Cemetery. It's an incredible experience to continue to serve, just as Mark said, serving this community. I had very much the similar experiences when I retired. I retired after 20 years in the Army. I was a paratrooper for 13 of those years, 5 with the 82nd Airborne Division, and my last 8 years with Special Operations Command. I decided to, come to Idaho. I passed through Idaho in the mid-90s when I was stationed at Fort Lewis, Washington. And I was just taken back by how beautiful, at the time I was passing through, was the mountains just golden in color. And I said, this would be a great place to retire and bring my family to. And I did that. Short stint after the military, I worked as an independent training consultant I was an instructor for MARSOC, the Marine Special Operations Command. And then I also worked as a director of support operations as a junior executive for a government contract company. Coming here to Idaho, though, I mean, I was looking to reinvent myself, give myself a great new career with my children and my family. Then things kind of slowed down a little bit. Couldn't find a job for a while, and just to kind of echo what Mark was just saying, I got hired with Division of Veterans Services and worked with Bill Heyob as one of his service officers. And again, the same thing. I was just impressed with the level of technical competencies that team had. But what was also incredible to watch was what's very unique about Idaho, and it's one thing that makes us a great working relationship with our VA partners, is that communication in that respect. So the state, actually, Division of Veterans Services, works very closely with our counterparts with the Veterans Administration. The regional office director, the hospital director, these are things that are very rare in other states. And so that connectivity between the state and the Veterans Administration overall is just something that was not being done in other states, and it reflects in all of our clients, whether they're the clients that we have, getting their education benefits, whether it's also the disability benefits, the hospital use, cemetery, the nursing homes. We've seen it firsthand. If nursing home needs assistance, that Veterans Hospital is willing to give up resources to assist them. That doesn't happen everywhere. But overall, it's just been an incredible experience. We've got 2 cemeteries. I've been working on the Blackfoot Cemetery. We finally opened that Veterans Cemetery up in December. We did it December 7th, which was Pearl Harbor Day last year. It was a 5.5-year project. I mean, everything from identifying the property over there, meeting with the veterans communities over there, breaking the ground, working with the Veterans Administration, an incredible project. And our division has another great project in Post Falls as well. So we're continuing to grow. Just as Mark said, the challenges that we have right now is to meet the demands of the growing population. That is something that, is just a challenge every single day. We're probably doing close to 20% over what we typically do here at the Veterans Cemetery this year. And it's one of those things we're competing against. Not only nature, every year we've got to compete against high growth seasons, heat, everything else. And I've got an incredible team. Our team is made up of 10 full-time employees here, myself is one of them. And many of our employees have been here for over 10 years. Their level of dedication that they put into the things that they do to display that national shrine standard on the grounds, the compassion given to the families at the time of need, is just incredible. And as Mark said, that level of attention and care is given, whether it's the OVA, the education, the nursing homes, the central support office. Everybody's focused. We understand our clients very well, and it resonates. Many of the folks that I talk to just coming to the state will tell you we have a reputation. And we're building a reputation throughout, not only throughout the Northwest, but as folks come here, they're looking at those resources. They go online, they look at the feedback, how many stars you have, what are the comments people have. They look at the pictures, and that's what's bringing them here. And it's because we have an incredible standard, we have an incredible trust with our clients, and it goes both ways. So again, just happy to be here. Mitzi, thanks again, for inviting me. It's been a while since last time I was at the, I think it was the Meridian Police Department where we met.
Boise Police Department, yeah.
Yeah, Boise, yeah. But also just to let you guys know, also this is not a bad time also to remember and pass on for your consideration for Wreaths Across America. We were able to do an incredible we had to restrict the ceremony last year due to COVID. We left it with pretty much with folks who truly had a loved one here at the cemetery to place those wreaths. But we were able to raise 5,000 wreaths to be placed throughout the cemetery, and the recovery again was another incredible experience with the community to come together and help us recover the wreaths after that. But we're preparing for Memorial Day. That's our Super Bowl weekend, and I don't know if that's a copyright. I can't say Super Bowl or what, but it's our big weekend, and so the staff is busy to try to get as many of the headstones as they arrive in place, immaculately trim and maintain the grounds. We're going to get some support from the Mission Continues, a veterans service organization. It's going to help us do the Avenue of Flags. The Young Marines are committed to come out and hand place the flags throughout the cemetery on every gravesite on Memorial Day. And then this year, we're also going to, since we're not going to have the full ceremony, the seated ceremony, we're also going to apply some demonstrations. These demonstrations, if approved, fingers crossed, fly over by the U.S. Air Force starting at 10 o'clock. The traditional cannon salute that many of you may be familiar with from Jeff Packer and the Idaho Military Museum will do the cannon salute. And then we'll have a rendering of taps performed by live performance by members of Bugles Across America, and a good friend of our cemetery, Bud Lancaster, with the Boise Highlanders, will be performing Amazing Grace. And we're going to continue that, the taps and Amazing Grace performances at 12 o'clock, 2, 4, and then 6 p.m. That day. So anybody who's in the cemetery during those times will get a chance to, listen to those performances. And somewhere along the line that afternoon, Warhawk Museum will do a vintage aircraft flyover. They're going to build us into their route as they make their tour throughout the Treasure Valley and throughout other counties within the state. And so as they come over, again, we'll have folks out there. So I encourage everybody to please come out, spread your visits out there. We've seen the governor move to stage 4, which is a great thing. It's a great thing for the entire state. It's also a good indicator of improvements and things that we're seeing related to COVID. But we do encourage folks to spread their visit out throughout the weekend. Include that Friday, Saturday, Sunday, and Monday as part of their experience, rather than just consolidating one day. But Mitzi, thank you again. Mark, again, it's great to see you. I think that's Bill Heyob on there. So I see an icon at the bottom. And again, good morning, everybody. And I truly appreciate everything that you guys do. You guys are a phenomenal group, and to see you guys assembled and continue to communicate with the interest of veterans in mind is just, again, it's very heartwarming and it's inspirational. So thank you all.
Well, and as you mentioned, we've modified the Memorial Day ceremony from what it has been in past years. We are lucky that we are in stage 4 now with the state as far as COVID, and so we can gather a little bit more. But we are going to have a special unveiling of a new statue at the cemetery on Saturday, the 29th of May. And do you want to tell us just a little bit about that, James?
Well, Mitzi, you probably have more information than I do on it, but we're going to meet later this morning, with I believe it was probably an inspiration of Governor Dirk Kempthorne, working with an incredibly talented Idaho artist who has, I think, 3 statues in the U.S. Capitol, Mr. Ben Victor. Young man, but an incredible artist. and the community overall. Some of Idaho homegrown businesses that are nationally known, things like Albertsons, Guho Corporation with Nick Guho, and you've seen his work. Not only is his signs all over town, he's doing great things all over town, but he was the contractor that built our cemetery here in Boise. And this statue, over a year in concept and construction, will be placed at the Idaho State Veterans Cemetery in our upper section of our flagpole. As many of you visited, we have our flag plaza up there, but the traffic circle that leads to the main flagpole right there at the southern end of the route is shaped like a teardrop. And this is a statue that spans multi-generations of military service. When you get a chance to look at it, it will reflect not only the incredible service of folks from Vietnam and in our past service, but also reflects the future service, those currently serving and where we're going as a nation. And that connection, it's something that all of us, and I believe this, everybody who's on this conference call right now, we have a connection with veterans, and you'll sense that when you see it. It's a lot of hard work. This is going to be a tricky one to add in there, but it's necessary, and it's something that truly is going to be again, it's going to be something that continues to highlight what Idaho truly is. When you look at our veterans cemetery, we've got folks in Montana, a new director over there, great friend of mine. His folks over there are getting tired of saying, we need to be like Idaho. We need to be like Idaho. They're modeling, their operations, their staffing, their standards to very much like what we're doing. So, Mitzi, I don't have too many more details. I think I tried to sum that up as much as I know. But it's going to be, we're just going to encourage folks. And if when you break out of this session, let folks know that just be patient for that day, because this one goes together, under very short considerations. There's a lot of, concerns about whether or not we could do something of this unveiling for the public under stage 3, but as we've seen, improvements allowed for stage 4. And so just exercise patience. Folks will get a chance to visit it all throughout the weekend and then thereafter. So yeah, that's all I've got on that. Thanks, Mitzi.
Well, and that's what I would encourage. The public is invited to the unveiling, but James and his staff usually spend 4 to 6 months planning for Super Bowl weekend, for Memorial Day, and we have kind of pulled this unveiling together in the last couple weeks, and it is going to be magnificent. But I would encourage people to come out throughout the weekend. The traffic will probably be a little bit less, and it's a very solemn statue, and honestly, I think that viewing it without a lot of people around is going to be very nice. So keep that in mind. The cemetery is open until dusk every day, and that's really a nice time to go out in the evening to the cemetery, no matter what the time of year is, but around Memorial Day, it really is quite special. So, James, I'm going to ask you one other question, because I see it come up quite a bit, and I think that a lot of people don't realize that you can pre-register at the cemetery as a veteran, and it actually saves a lot of heartache, I guess, if a veteran passes away and they haven't pre-registered. There's a lot of scrambling to get the paperwork done, find that DD 214 if they don't have it. And so do you want to tell us a little bit about your pre-registration services?
Yeah, thanks, Mitzi, for bringing that subject up. So one of the things that as veterans start to explore their benefits, knowing that they have burial benefits at one of our state veterans cemeteries, is one of the things they can do is what they call pre-registration with us. Our applications are all on our website. You can always stop into our office or call our office, and we can get you a copy of that. And I know those applications and packets are pretty much at every veteran VSO office that we have throughout the state. What the pre-registration program is, single application, which allows you to complete the application for both the veteran and the spouse, and provide the supporting documents such as your military discharge document, DD-214, and a marriage certificate for the spouse. What the DD-214 does is allows us to verify the eligibility. The eligibility for burial is based on a single period of active duty service. So as long as your DD-214 is, if you're a retiree or the last period of service that you served in, ensure that that one is the member 4 copy at the bottom right-hand corner, because we need to have the character of discharge on there. So it must say honorable, must have your highest rank on there, and it should show those periods of active duty service. Once we have those documents on there, we'll scan those, we'll put them in the database. If they're eligible, we'll send a letter to the address on the application. It takes about 4 to 6 weeks. Process, mail, and receive on your end there. Once you have that, it gives you peace of mind knowing that, okay, I have all my information at the Veterans Cemetery, and I can go on 30, 40, 50 years of my life, whatever you want to do. And it doesn't make any commitment, meaning that if life takes you in a different direction and you move to Florida with the grandchildren there, doesn't mean, I'm stuck at the Veterans Cemetery in Idaho. But what it does give you is that peace of mind that while you're here, this is your location. As Mitzi said, unfortunately, there are cases that families have to scramble to find military discharge documents, and I know it's difficult. Some of these are 50-year-old documents. They've gone through multiple moves in life and things of that sort, and paperwork gets shifted back and forth. But we work closely with Bill and his team at the OVA. Anytime the family says we can't find military discharge document for a loved one, first thing we do is we'll contact the OVA to see if they have anything on file with them. If not, then we recommend that they try to contact the National Archives. But unfortunately, that is a difficult process. That's something that takes a very long time. So right now, any of your members out there, just in conversation, look for the discharge document, get a pre-registration. It takes less than 5 minutes to fill out the application. If the application is confusing, stop in to our cemetery. Myself or one of my staff members will be glad to help you fill out that application. But one of the things to keep in mind is, unlike a private cemetery, when you pre-register, you're not guaranteeing a spot. Veterans burial plots are assigned on the actual time of need, meaning that we fill the next available opening in that column, that row, that section. What I explain to folks is that's why veteran cemeteries are considered, in my eyes, a living memorial, meaning that they continue to grow as time goes on. Private cemeteries, you're allowed to pick a spot, reserve a spot, and then you could say that's your location in the future. You have by pre-registering, you have the peace of mind that you're eligible. That's the biggest thing to consider, is determine that eligibility now, so that you can communicate that with your loved ones. And once you have that letter, put it in there with your will, important documents, communicate that, your wishes, with your family members, your funeral directors, your funeral home, whomever you're working with, to ensure that, at the time of need, the stress on the family isn't something that, will add more confusion and stress.
That sounds great. And I'm going to ask you one more question, James, because I think it comes up, and this is a good group to kind of clarify that with. We have 2 state veterans cemeteries, Boise and Blackfoot, but there's also a cemetery in Buell, and I think a lot of people are confused that it is a veteran cemetery, but can you explain that, what the Buell Cemetery is?
Yeah, over the past year, Idaho has now pretty much in almost every direction has coverage of veteran cemetery. With the construction of our veteran cemetery in Blackfoot, it is a state veteran cemetery, as Mitzi identified. That's why you'll see Idaho State Veterans Cemetery. This veteran cemetery in Buell is a national veteran cemetery. That one's called the Snake River Valley National Cemetery. That one is operated and funded specifically through the Veterans Affairs. Although we can help answer questions from the community with regards to that, we can't schedule any services for them. We don't do any of the markers for that particular location. One of the key differences between the 2 cemeteries, though, and it's something that I'll be working with with Mark on is possibly, legislation that helps, reduce the difference. The National Cemetery in Buell right now, if a spouse passes away, the veteran can utilize his benefit at that location, and there's no cost for any of the services for the spouse. Because it is a federally funded, federally operated veteran cemetery, their rules are a little bit different when it comes to spouses, the fees essentially. Here at state veteran cemeteries, we do have to charge fees for eligible dependents and spouses. And that's one of the things that I'm trying to, for many years, try to communicate that I think we need to work on, not just for the state of Idaho, but overall. But yeah, so between the differences, as Mitzi had said, that one is a national cemetery. We don't do any of the services. We don't do any scheduling or anything of that sort. And it's a fairly small cemetery. If any of you have visited Buell, the veteran cemetery there, it was part of the Rural Initiative program by the National Cemetery Administration to add a national cemetery in rural states with rural populations to help ensure that veterans have a 75-mile radius to the burial benefits that they're entitled to.
That's great. Okay, well, thank you for that. Our next guest that I'll introduce is Bill Heyob. He is the director of the Office of Veterans Advocacy. It is part of the Idaho Division of Veterans Services. And for those that have visited me in my office, I had been located out of the Central Support Office across from the Veterans Home there on the VA campus. But I have now been moved down to the Office of Veterans Advocacy. And I'm excited to be working with Bill and his team, and it's a really good fit for me down there. So, Bill, I think almost everybody knows you, but do you want to introduce yourself to those that don't know you, give a little bit about your history?
Well, good morning, everybody. Hopefully you can hear me, and I'll start out by apologizing for being UA for morning formation for this meeting. I think Mark is going to be conducting non-judicial punishment on me for being UA, but I'm still hazing myself. So again, my name's Bill Heyob. I'm the Bureau Chief for the Office of Veterans Advocacy. That's a fancy way of saying I'm in charge of all the state service officers for the Idaho Division of Veterans Services. And I came from the great state of Ohio, go Buckeyes, and spent 24 years active duty in the Marine Corps from 1988 to 2012. Served at most of my time in the infantry, also field artillery, first sergeant for Charlie Company, 4th Tanks over at Boise, company first sergeant for an Amtrak company out at Camp Lejeune, North Carolina. Served in Just Cause Panama, Honduras, when everything went south in Nicaragua, Desert Shield, Desert Storm, Decisive Endeavor, and Deny Flight, Bosnia, Ramadi, Iraq, Helmand Province, Afghanistan, and deployed to Okinawa 5 times for 7 months as a shot. So I was also a drill instructor at Parris Island. So when I retired, I had no idea what I was going to do, and Gary Randall helped talk Dave Braswell into hiring me because he felt sorry for me and didn't want to see me be a homeless veteran down on downtown Boise. So I've been working here for coming up on 9 years now. Again, we're all the state veteran service officers. We got our hands involved in everything. Myself and 4 other service officers are located here in the Boise regional office, along with Mitzi, Tiffany, and Janelle. And then we have 3 service officers in Caldwell. I've got 2 in Twin Falls, 2 in Pocatello, 2 in Lewiston, and 2 up in Post Falls. And the Idaho State Approval Agency for post 9/11 GI Bill education also falls under my bureau. So, with all that said, hopefully you've all seen my quarterly news bulletin that Mitzi flooded out to everybody. So I'm going to real quick hit some of the high points on what's going on, because this is what's important with what's going on these days. Again, I'm sure you're aware of VA Medical Centers offering free COVID vaccines to all veterans, whether they're enrolled in VA medical health care or not. along with spouses and caregivers of those veterans. The VA Debt Management Center out of St. Paul, Minnesota, has suspended collecting all debts owed back to the VA for whatever reason, whether that's a VA Medical Center copay or a debt owed for education or to the regional office. That's suspended till September 30th, 2021. That doesn't mean the debt went away. They still owe the money back. They're just not going to collect until after September 30th, 2021. I'm sure by now everybody knows VA Medical Center implemented the Mission Act and allows veterans to use community care to get treated out in the community. And what happens is the VA Medical Center helps set up those appointments, and then Tri-West pays those bills. Don't confuse Tri-West with TRICARE. Many years ago, Tri-West did manage TRICARE for the western part of the country, but not any longer. So they pay the bills. There's a lot of problems with some of these places getting paid, and they're throwing a lot of veterans into collections for non-payment. So VA has started up a phone number, toll-free number with an office just specifically to help pay these bills and figure out what's going on. And if you got my bulletin, you got the number already. If you don't have it, the number is 877-881-7618. Again, that's 877-881-7618. And that is specifically to help veterans resolve collection-specific issues resulting from authorized VA community care that is not being paid. Again,
I think some examples of that might be an ambulance ride that you get billed for after the fact, things like that. Is that right, Bill?
You are correct. Or they're able to go out to see a specialist out in town for whatever condition, cancer treatment, heart, spine surgery, whatever, and they go many months without being paid and start sending collection notices to the veteran. This has been a major impact. The National Personnel Records Center out of St. Louis, Missouri, also called the National Archives, they're still hiding behind COVID, is not doing their jobs. And if you go to the National Personnel Records Center, it's got a big pink banner on their website asking everybody, do not request copies of DD-214s, active duty medical records, personnel records, request administrative corrections if something's wrong on a DD-214. Don't ask for replacement medals. And it even has a thing saying don't call them because they don't man their phone numbers and they don't respond to any messages left. This has been bad because VA will not process claims for initial claims until they have medical records from someone's active duty service. And we've got some claims that are coming up on a year old because National Archives are not pulling those records. So again, something to be aware of. They're supposed to be trying to stage bringing more people back and start doing their damn jobs, but something to be aware of. The National Defense Authorization Act of 2021 approved 3 new presumptive conditions for Agent Orange presumptive conditions. So again, this is anybody that served more than 2 seconds boots on ground Vietnam within 12 nautical miles of the Vietnam coastline, along the DMZ in South Korea from 68 to 71, along the perimeters of the air bases in Thailand, or worked on flight or ground crew for C-123 aircraft until 1986, because those were the predominant aircraft used as sprayed herbicide agents in Vietnam. They group all those into the category Agent Orange, even though there was also Agent White, Agent Purple, many different things. And believe it or not, Agent Orange is not orange. That's the color of the stripe on the barrel. I got veterans coming in here let me know that they got sprayed with so much orange, their camis turned orange and they could never get it out and their skin's orange. The herbicides were clear, just to be aware of that. But they're adding the 3 conditions: bladder cancer, hypothyroidism, and Parkinsonism or Parkinson-like symptoms. And that's along with the conditions already there, which is the prostate cancer, type 2 diabetes, coronary artery disease, ischemic heart disease, past heart attack, lung cancer, respiratory cancers, Parkinson's disease, multiple myeloma, non-Hodgkin's lymphoma, hairy cell leukemia. So again, if we can prove that they were exposed they were at any of those locations, we can do a claim, get them service connected. Even though this was approved on the National Defense Authorization Act, the VA still has not come up with the final rules on when they're going to start granting this. I was just going through VFW service officer training, and the Undersecretary of VBA says that this should be approved in the next couple of weeks. So hopefully that's the case. Another big change with the VA, if someone has a service-connected knee or hip replaced, they used to get 13 months of temporary 100% rating from the VA. That has been reduced down to 5 months. They were saying that because of medical advances, people don't need 13 months to recover from a knee replacement or a hip replacement any longer. So again, something to be aware of. That went into effect February 7th of this year. They also passed the Johnny Isaacson and David P. Rowe Veterans Healthcare and Benefits Improvement Act, and this does all kinds of things. A veteran can pull their disability benefit questionnaire, which is the exam form, and take that to their doctor and have it filled out and submit it with a claim. They used to be able to do this before. The VA quit allowing that because they said there was rampant fraud going on from veterans that were contacting these online places in Puerto Rico, and as long as you pay $500, a doctor you've never seen before will write whatever opinion you want. So the VA quit allowing that. Now they're allowing the DBQs again. The only exam you're not going to get is for post-traumatic stress disorder or for hearing loss. So they're allowing that. If somebody's receiving dependency indemnity compensation, surviving spouse whose veteran spouse died of a service-connected condition, it used to be as long as they did not remarry before the age of 57, they would continue to receive those benefits. They reduced that. Now, as long as they don't remarry before the age of 55, they continue to receive the benefits. If they are receiving DIC and they do remarry before 55, the benefit stops. And then if that marriage ends in death or divorce, they can go back and refile for DIC on the original veteran who passed away from a service-connected condition. The VA just changed the dates for the start of the Vietnam War. And it used to be they had to, if they served boots on ground in Vietnam starting in '61, they would be considered wartime veterans. And they had to be boots on ground as part of an advisory group. That date has been moved back to November 1st, 1955, because VA recognizes that we did have American troops over in Vietnam as advisors beginning in '55. Why this is important is if somebody is filing for non-service connected pension or a surviving spouse filing for survivor's pension, that veteran had to have at least 1 day of wartime service. So again, these dates only impact those that serve boots on ground in Vietnam. If they did not serve in Vietnam, the actual start date's not till 1964 and runs till May 7th of 1975. So just be aware of that. They had to have 1 day wartime service to be eligible for pension. The VA is going to eliminate the 12-year limit for using VOC rehab through the VA. Starting in 2023, veterans 81 and over are eligible to get onto a VA life insurance program. That's a $10,000 policy. Again, that don't go in effect till 2023. Currently, any veteran can get this $10,000 policy. Yes, it costs you money, but you have to do this within 2 years of getting service connected for a new condition. The FEMA just came out with COVID funeral expense reimbursement. Again, the information is my quarterly bulletin. You have to let the FEMA know all federal money that someone has already received for burial reimbursement, which includes VA reimbursement. And again, if a veteran dies of a service-connected condition, VA will pay a one-time payment of $2,000 to whoever paid for that funeral after the funeral's paid for. If the veteran is receiving monetary benefits and dies of something non-service connected or passes away in a VA facility, the VA will pay a one-time payment of $300 for a non-service connected benefit. Again, this is like a last reminder. Anyone rated 100% service connected or receiving individual unemployability from the VA has until May 17th to get your letter to the VA or to your county assessor's office showing that you're 100% or on IU. So you get the $1,320 property tax reduction off your 2020 bill. I'm almost done. I know you're tired of listening to me already. Something to be aware of. VA forms are starting to have demographic information on there, asking a veteran's race, ethnic background. I was surprised the first time I saw this. I thought a veteran was a veteran, but apparently the federal government wants to start tracking demographics on what veterans are receiving, what benefits, to make sure there's not a certain ethnic group that's getting more VA benefits than others. Secretary of the VA is urging people to file presumptive claims for burn pits. And this is all over social media. I've been getting contacted. Here's what's really stupid about this. There's nothing presumptive to burn pit exposure. The only thing presumptive for Southwest Asia is irritable bowel syndrome, chronic fatigue syndrome, fibromyalgia, or undiagnosed illnesses of Southwest Asia. VA will consider anything on a presumptive basis if you have a letter from a doctor saying, in my opinion, this chronic condition was a result of an environmental or toxic exposure from whatever, and here's what I'm basing that opinion on. But the federal law, the 38 Code of Federal Regulations, does not grant any presumptive conditions due to burn pits. So again, something to be aware of that. We're seeing a whole lot of surviving spouses coming in here with death certificates that says a veteran died of COVID-19. Urge everybody you know, do not let them just put COVID-19 as a cause of death. A veteran's service-connected disability benefits stop when the veteran dies, and then the surviving spouse has to put in one of two claims for survivor benefits. One is DIC, dependency indemnity compensation based on service-connected cause of death, and the other one, survivor's pension. So if a veteran is service-connected at 100% for coronary artery disease or Parkinson's disease, that death certificate has to have coronary artery disease or Parkinson's disease as a cause of death or contributing cause of death. These surviving spouses are getting totally screwed over by only having COVID-19 listed on there or natural causes or something not service connected by the VA. And then this is delaying them getting benefits as we're telling them they got to go back and get the death certificate amended to add a service connected condition on there. So the veterans benefit stops until we can get them approved for DIC. And again, right now, DIC is $1,357.56 a month. Doesn't matter how much money the veteran was getting. And survivor's pension is a lot less than that. So again, I've been flapping my jibs for a while. That's the important stuff going on with the VA right now. And again, we're not the only office that helps veterans and surviving family members with their benefits. We have the DAV located right next door to us. They've got 3 service officers that represent solely on behalf of DAV. Our office represents on behalf of Veterans of Foreign Wars, American Legion, AMVETS, Fleet Reserve Association, Marine Corps League, and the Idaho Division of Veterans Services. They do not have to be a member of the VFW or American Legion or anybody else to be represented by us. That's just the nationally chartered organizations that we're accredited with. But again, don't forget about the DAV right next door to us, because I've been told they do good things too. Just kidding. I got to get my jab in on the DAV. And again, I'm sorry I was late coming in. And I'll be reporting to Mark for my non-judicial punishment here very shortly for being UA. If anyone has any questions, go ahead and throw it at me.
Now, I do want to mention that Bill can, spout this stuff off the top of his head, but every one of our state service officers has the same knowledge. It might just take them 2 to 5 minutes to look it up, but they can all help you with this also. Bill, I want to ask you about a benefit. It's called aid in attendance, and I think a lot of people don't realize that it's out there, and I think some people in this group might have some people that might qualify for that. Do you want to just give us a quick overview of that?
So aid in attendance is a misnomer. There's 2 ways of looking at this. If somebody is service-connected for service-connected disability compensation, the VA has a thing called special monthly compensation, where if a veteran needs help with activities of daily living, they're totally bedridden, they can apply for special monthly compensation. To be eligible for that under the service-connected side, the veteran has to be rated 100%, and they have to have a single 100%. So they have to be rated 100% for coronary artery disease, 100% for Parkinson's disease, 100% for cancer, and need help with activities of daily living for that. Biggest example we see is ALS, Lou Gehrig's disease. As long as someone has 90 days of active duty and gets ALS anytime in their lifetime, they're going to get paid 100%. As their condition worsens with ALS and they need more and more help and they're on respirators and all kinds of stuff, they can apply for a higher level of special monthly compensation due to aid in attendance. So if they're towards end of life stage with ALS, depending on the level of special monthly comp, 100% is about $3,200 a month for a married veteran. With special monthly compensation for ANA, they could be receiving up to $7,000 a month. So that's how it works with service-connected disability. A lot of times, if someone's trying to get into an assisted living facility, they're told to come talk to us about ANA. They're actually talking about non-service connected pension, and aid in attendance is just the highest level of pension. So to qualify for pension, they need to have at least 1 day of wartime service. So if they served between World War II and Korea, before Korea started, they're not eligible. If they served after 1955, when Korea ended for VA purposes, before Vietnam started, they're not eligible. And if they left after May 7th of 75 till Desert Storm started, they're not eligible. So they need 1 day of wartime service. Then they have to be below the net worth requirements. Currently, that's $134,000. So if it's a married veteran, this is combined assets. They can own a house. The house don't count against them. But if they sell the house, that's counted as an asset. And if they're renting the house out, that counts as income. So they add up everything, all the assets, what's in checking, savings, stocks, bonds, mutual funds, IRAs. If there's a family trust, what's the schedule of assets in the trust? They add all the combined assets. Then they look at all forms of monthly income, Social Security, any kind of retirement for both the veteran and the spouse. They add that to the assets. And then they subtract out 12 months of out-of-pocket non-refundable medical expenses, and they subtract that from the annual assets and income. You have to be below $134,000. If you meet that, the next step is they assign a pension rate based on what the veteran's health is. Don't matter what the spouse's health is, what the veteran's health. If the veteran can live on their own and take care of themselves, that's the basic pension rate. if they can live on their own, but they're indoors all day, they can't drive, and they need someone to pick them up and drive them to appointments, that's a housebound rate. And if their health is so bad that they need help with activities of daily living, bathing, dressing, feeding, transferring, toileting, that's the aid and attendance rate. Biggest difference, and then the VA assigns what's called a max annual pension rate based on the level of pension needed. So if someone qualifies for the aid and attendance rate and they're in assisted living or skilled nursing, anything they're paying per month for that is considered out-of-pocket non-refundable medical expenses. If they qualify for the housebound rate and they're in an assisted living or independent living, that does not count as out-of-pocket non-refundable medical expenses because they're choosing to live there. It's not a medical requirement unless we get a letter from the doctor saying that they have to be in a protected environment and that facility is providing the protected environment. So with all that said, if it's a single veteran and they qualify for the aid and attendance rate of pension and their medical expenses are more than their income, the absolute most the VA will pay is $1,936 a month. If it's a married veteran and they qualify for aid and attendance and the medical expenses are more than their monthly income, the absolute most the VA will pay is $2,295 a month. And if it's a spouse of a veteran, surviving spouse that qualifies for pension at the aid and attendance rate and medical expenses are more than income, the absolute most the VA will pay is $1,244 a month. Again, that's usually not enough because assisted living, as everybody knows, can cost anywhere from $3,000 to $10,000 a month. This normally just helps them tread water till all their assets are gone and they have to file for Medicaid. But that's how aid and attendance works.
Well, and again, every veteran is different. Every situation is unique. And I tell everybody this all the time, especially when I'm out speaking to different groups, is if you have a service-connected injury, whether you've filed for it or not, make an appointment to come in and see a service officer, because as you can see, there is a lot of information, a lot of details, and Bill and all of the other state service officers we have can pull that information out, just interviewing the veteran and figure out what they qualify for. And they really do some outstanding things in the Office of Veteran Advocacy. So thanks a lot, Bill. And as you can see, I am really enjoying being over in that office. Never a dull moment with Bill and his staff. So Mark, would you like to give us some parting words, wrap things up for the meeting?
Yeah, sure. I mean, first Bill needs to hit the deck and give us 20 for his tardiness, but other than that, I think in general, again, I'm approaching, this is basically my 4th week in this position. Again, I'm absolutely blown away and just amazed at not only the services that currently are available for veterans, but the organization of this group in terms of joining forces to get together and to coordinate those services that all collectively that we provide to veterans is, I think, just a phenomenal step in a very good direction towards helping our veterans to the maximum that we can. And so I appreciate everybody taking the time to join this meeting to kind of learn about this stuff. As you can tell, there's lots of things out there. There's lots of ways that we can help veterans, and the more connected we are, the better we're going to be able to do that. So again, I appreciate everybody that's on the call. I appreciate the time that you're taking to help coordinate these services for our veterans and their spouses and families. And look forward to working with all of you in the future.
Okay, thank you. I'm just going to ask, I don't see them on here, but I had somebody from the Boise VA Medical Center that was hoping to hop on the last 5 minutes to give us an update on vaccines. Is there anybody here, Corey or Jeanette?
Good morning. Yes, I'm here.
Okay. Hi, Jeanette.
Hi, thank you so much. Hi, guys. My name's Jeanette Berry. I'm a registered nurse from Boise VA. Just wanted to share a little information about vaccine, give a little background about myself. I've dedicated my whole entire nursing career to Boise VA and to making sure our veterans get the best care. I've served in step-down unit and intensive care unit, and now I've transitioned over from 5-star alarm, people are really sick, over towards prevention methods for the Veterans Health Education Coordinator. I also serve currently as the Boise VA Vaccine Coordinator along with Lindsay Castor. I want to say thank you to each and every single one of you for your service to our country. And again, I'm here to talk about the COVID vaccines. I realize that there's a high volume of stress and even polarization regarding this topic. And people have a lot of questions and sometimes inaccurate information too. Most of the questions on vaccine that I help answer on the daily are regarding the timeline of the vaccine release, ingredients, side effects, how the vaccines work, and about natural immunity versus vaccine immunity. I've gotten to help on the front lines with COVID and see the impacts. And I think we've all gotten to see somebody who has been impacted by COVID. And it's been random too. It's been hard to feel the sense of urgency in some cases because some people have no symptoms. Some people have had a light cold. And then some people have felt the sickest they felt in their life and maybe needed to go to the hospital. And maybe you even know someone who has died from COVID. I also know a lot of younger people who are in their 20s, 30s, and 40s who are currently suffering with long hauler symptoms. And long hauler symptoms are for someone who has had a COVID infection and they have not fully recovered. And so, you know, younger friends of mine have personally been impacted by the long hauler symptoms where they are either having brain fog and trouble focusing, trouble with their breathing. Some people I know need to go to a cardiologist now that never needed to before. And then also I hear for months about people who have struggled with getting back to their normal baseline level. I also know of a younger female who in her second trimester lost her baby after her COVID infection because she had gotten blood clots related to her COVID infection. And I just know that COVID can either have really minimal impacts or it can have catastrophic, devastating impacts. It really can be a lottery, regardless of people's age, regardless of people's prior health factors. And so this is a topic I take very seriously because we do have a highly effective tool to beat this. I want to share that we have 3 different vaccine options, Pfizer, Moderna, and Johnson & Johnson, which are all excellent vaccine options. When we were starting off with this journey of getting ready for vaccines, we heard that if the vaccine was even 50% effective, it would be worth it. And now we know that the Pfizer and Moderna vaccines are around 94 to 95% effective at preventing severe COVID infection, meaning preventing people going to the hospital and being really sick. And then the Johnson & Johnson vaccine, they said up to 86% efficacy at preventing severe COVID infections. I personally chose to receive the vaccine. I received the Moderna vaccine, and I just wanted to share a little bit about my story, how proud I was and how hopeful I was to be able to move forward past COVID by receiving the vaccine. And I was amazed reading the literature backing the science of these vaccines and trusted it. And I was blown away with the American ingenuity to make this happen, especially with the Moderna vaccine. I hope when you make the choice to be vaccinated, you can feel the same hope that I did. For some of our veterans, the motivation to choose vaccination stems from various resources, whether it be protecting themselves and their families, wanting to get back to normal, which we all want so bad. And some people were also excited hearing about after being fully vaccinated, you don't need to quarantine anymore after a COVID exposure. I know some people really cannot afford to be off of work for 2 to 3 weeks while they're quarantining or recovering from COVID, or potentially even risking long hauler symptoms. We do know that people who are, the sooner we get people vaccinated, we can save at least 100,000 American lives. And I wanted to let you guys know that through Boise VA now, thanks to the Save Lives Act, we are now able to vaccinate all veterans, even people who are not enrolled or maybe had a different discharge from the services. We also are able to vaccinate a veteran spouse. We can vaccinate veteran caregivers, and the terminology for this is really open. It could be a friend or a family member or caregiver who takes care of a veteran with their daily activities, with their groceries or transportation. So it's a pretty open definition of caregivers. And then lastly, the Champ VA program for beneficiaries of that. If you guys are interested in receiving your vaccine, the phone number for Boise VA is 208-422-1499 to get scheduled. Boise VA currently, they only offer 2 vaccine options. They have Moderna and Johnson & Johnson. I also want to let you guys know that the community is also open for walk-ins at multiple locations, and they have multiple different options available. So if there's a certain vaccine you're looking for, it may be beneficial to call ahead to the clinic you're looking at and ask which type of vaccine. The choice is yours. Nobody's pushing you. Nobody's forcing you to receive the vaccine. So anyways, that's about that. I have 3 asks of you guys. If you have questions about the COVID vaccine, I encourage you to talk with your medical team. Boise VA veterans can send a secure message or call the 422-1000 number. Number 2, if your group is interested in a presentation to discuss the facts of the vaccine, I want to let you know that VA is a resource for you, and we would be happy to send someone to come talk with your group. And then lastly, if you're open to sharing, we want to hear about your experience with the COVID vaccine. I personally am interested in showcasing some local stories to try to make this part of our normal conversation. We do know that no human disease has reached herd immunity without a vaccine. I know I'm already out of time for the day. I'll put my email in the chat. If you're interested to follow up with me, I'm happy to be a resource for you. I just want to close with, this is your choice to receive a vaccine. We do know these vaccines are safe and effective, and Boise VA is here to help you. Thank you all so much for your time and service. I wish you all good health, and I look forward to continue this continuing this discussion. So thank you guys so much.
Thanks for joining us, Jeanette, and I'll include Jeanette's contact information in the meeting recap that I send out. So if anybody would like to contact her, and like she said, she's available to come out and give presentations to your groups. So thank you everyone for joining us today. Thank you, Mark, James, and Bill for taking time out of your schedule to join us, and we will see everyone next month.
Thank you.